It's a beautiful day in terms of the weather, but also what we're about to do. I'm Donna Lynne, the CEO of Denver Health, and I am so thrilled to be here. And I know many of you work here, are patients here, and we're excited to break ground today on the Sandos Westside Family Health Center. Now, this has been a long time coming, and we are so thrilled that with Denver Health Resources, with the community, and certainly with Vibrant Denver, yay, we are able to put the shovels in the ground today. I want to acknowledge some of our Denver Health board members who are here, Jim Chavez, Patty Klinge, and Tom Kim. Also, a former board member, Russ Heisey, who is somewhere here, Sue Powers, and our Community Health Services Board, and I've seen Carol Lewis, Eddie Sierra, Sarah Carpenter, and I think I've also seen Fred Glick from our foundation board. So thanks to all of you and the support that you give us. You're going to hear from Mayor Johnston, from Councilwoman Torres, both of who had a critical role in supporting this venture. You're also going to be hearing from Dr. Simon Hambridge, who is the former Chief Ambulatory Officer at Denver Health, who was also instrumental in getting this off the ground. As well as Dan Sandos, one of the sons of the late Sam Sandos, Denver City Councilman, for whom this center was named. So thank you again to everybody who voted yes on Vibrant Denver. And because of this, Denver Health will receive $20 million towards the roughly 100+ million that's necessary to build this project. And it's not just rebuilding a health center, it's a commitment to this community that we feel strongly about, and a commitment to high quality care for the community. For nearly 60 years, this Westside Clinic has been a crucial first point of contact for patients to be able to access resources such as nutrition assistance, housing, domestic violence support, and more. Today, more than half of our patients here at the Westside Clinic are under the age of 20, and we need to give them a healthy start to become engaged citizens and workers in our community. We actually see patients from all 11 Denver City Council districts and the surrounding areas, and they choose to come to the Sam Sandos Westside Clinic. But the truth is we've simply outgrown our space, and this has taxed everybody. From our medical teams who are stretched to capacity and sometimes overwhelmed by the demand, to patients who struggle to get limited access to services they need. The new Sam Sandos Westside Family Health Center will add more than 30,000. Could the drums please stop?
I'm gonna block the wind for you. I'm gonna do the windshield.
The new Sam Sandos Clinic will add 30,000 square feet of space, and it will allow us to expand services in pediatric and adult primary care, dental care, and OBGYN care. We'll also be adding new offerings, including physical and occupational therapy, a wellness space for our staff, who clearly need that, and a suite of radiology services, including ultrasound, X-ray, and CAT scans, making it much more convenient for patients to receive care when they need it. When the Westside Clinic is completed in the summer of 2027, so a mere 18 months from now, Denver Health anticipates being able to increase patient capacity by 30% and to serve more than 33,000 patients each year. From generation to generation, Denver Health is there for life's journey, and we will continue to stand with Denver's West Side community, nurturing health and well-being for generations to come. I'm pleased to introduce our mayor, who's been a great partner to Denver Health, and certainly to getting this project off the ground. Mayor Johnston.
Good to see ya. Good morning. Great to see you all. This is exactly what we meant when we said we were going to move with urgency on bond projects. I don't think anyone quite imagined that meant we would be putting shovels in the ground before the election is actually finalized, but we're not waiting. This measure is passing with almost 70% of the vote, so Council Torres thinks we're pretty safe on this one. But I just wanted to say, yeah, when we said the phrase, we're looking for projects that are shovel ready, this is what we were talking about. But I just want to say mostly a huge thank you to Donna, Lynne, and to the team at Denver Health. This has been such a staple in this community for almost 60 years. It's making sure everyone in all parts of Denver can get access to incredible quality care, and the ability to build a brand new location here that will be a draw for many, many years to come is going to be a fantastic asset for this neighborhood. And so we are excited for this to be the first of many, many groundbreakings in the Vibrant Bond, but most importantly, the first of many transformational community resources where you go to places you love, where you can get services you count on from people who are committed, and that is what the Vibrant Bond was all about. And so thank you for everyone who helped make this possible. I do want to say a special thank you to Councilwoman Torres, who fought passionately for this project at every stage, from our first community meetings all the way down to our final council votes. She was deeply committed to making sure that this got built. And Jamie Torres, you are the reason we are here today. So thank you so much and congratulations. Thank you all so much for being here. I'll give it back to the boss, Donna, Lynne.
Thank you, Mayor. And one of the things you should look at as we're talking is the board back here, because not only is that going to be a beautiful building with solar panels, it's also going to block the wind the next time we're in this parking lot. So we're going to be building literally where the shovels are. And I want to first say to the patients and the employees, the parking's going to be a little inconvenient for a while, right? Because we're going to utilize this land so we didn't have to buy new land and then ultimately knock that down. But we won't skip a day of care in the community as we build and open up this facility. So without further ado, I do want to acknowledge and introduce Councilwoman Torres.
Thank you, Donna. Thank you, Mayor. Good morning, everyone. This is a gorgeous morning to talk about this amazing project. And one of the things that I always keep thinking about is that were it not for Denver Health's reputation, for your connections to your patients, for your connection to the neighborhoods that Denver Health is in, these kinds of projects would not be possible. The prior tax supporting Denver Health would not be possible. Denver voters don't just vote randomly. They vote out of their heart. They vote out of their connection. And Denver Health for decades has been that connection. My grandmother came to this health clinic for 30, 40 years. She talked endlessly about Dr. Ryan. Dr. Ryan was her kid's doctor at Denver Health. And as though we lived in a small town and he was the small town doctor and you had that relationship. That is the connection that Denver Health brings to the Westside community. And so it is with absolute heart and joy that I am here today to help kick off this reconstruction of the Westside Health Clinic, named after one of my predecessors, Sam Sandos, and his family is here. I'm so grateful for your footprint in West Denver. That isn't past, it is contemporary, it is today, and we are preparing even the holiday baskets with the family to distribute to Westside families and families throughout the city. I am honored to represent this district. I'm born and raised across Federal on Lowell Boulevard, and there is nothing I love more than seeing direct investment in this community, because it went for so long without that kind of attention. And when you lack that attention, you think nobody cares about you. And so I'm just thrilled at seeing all of your faces here today, and the faces of our community when they walk through these beautiful doors of a facility that says we care about your health, and we're going to show it. We're going to show it as a city in our investment, and we're going to show it in a city in our commitment to your future and your kids' futures. Sun Valley is on the precipice of tripling its density, tripling the number of people that live in that community. West Colfax has already been there. Villa Park is coming along. And we're about to populate what you currently see a stadium at with neighbors. So there are a lot of things that are changing in this community, and this is one of those that we can put a flag in and say this is a change for the betterment of our quality of life in West Denver. So thank you all. Thank you all to the voters who supported this bond initiative, and thank you to everyone who came out today to support this groundbreaking. Thank you all.
You know, one of the things that some of you know about Westside is when you talk to people who work at Denver Health, they often say, I started at Westside, and they've moved around. And I want to introduce one of them now who not only started at Westside, but also has led Denver Health's ambulatory strategy. He recently retired, but worked for Denver Health for over 2 decades and was very involved in the discussion around how to rebuild Westside and our whole ambulatory clinic strategy, Dr. Simon Hambidge.
Thank you, Donna. Thank you, everyone, for being here to celebrate this exciting moment. Oh my gosh. I'd like to briefly share some Denver Health Westside, Sam Sandos Westside history, as well as reflect on the impact this place has had on me personally. On April 29th, 1968, the original Westside Neighborhood Health Center opened its doors 1 block south of here in an old hardware and lumber store. Now, I know Carol Lewis is here, and most of you know this, but Carol worked at Denver Health for over 4 decades as a social worker and has served on our Community Health Services Board for almost 2 decades. So she has almost 60 years of combined service at Denver Health. And she was 5. And it started at the original Westside in that old hardware and lumber store, which is amazing. On May 3rd, 1985, the new Westside Neighborhood Health Clinic opened. It's this building that is still here today, and sadly, as you have heard, it can no longer meet the needs of the community. Several years later, the building was renamed in honor of ML Sam Sandos, the first Latino city councilman in Denver. Yeah. Westside has always been committed to excellent community-based care, as well as to training the next generation of medical professionals. I first trained here as a medical student in 1991 with Dr. Jeff Brown. I was fortunate then to do my pediatric residency continuity practice here from 1994 to 1997, and I still remember those days very well. That experience changed my career trajectory. It led me to want to seek a career at Denver Health. And I was hired as a staff pediatrician in 1997, the year Denver Health became an independent authority. Thank you. Because of the impact Westside and Denver Health have had on me personally, as well as on the community and generations of medical professionals, I have made the most meaningful philanthropic contribution I have ever made in my life. And it is an honor to support the brand new Sam Sandos Westside Health Center. Thank you.
I want to acknowledge another one of our Westside physicians who's retired, but who also served on the Denver Health Board, Dr. Irene Aguilar, who is over here. And we will be naming a conference room inside the new building after Dr. Aguilar. So our last speaker before we do our groundbreaking shovel, we're going to have several shovel pictures, so I'm going to direct this in a little while, but we do want to hear from Dan Sandos on behalf of the entire Sandos family.
Thank you. I just, before I do too much, I have to pay respect to all of you. You guys are amazing, and Donna in particular. You have driven this project from day one, and it is very much appreciated. A quick shout out to Jamie too, because she really kicks some butt. I'm not surprised. Jamie's family, so she had to. So I really want to thank you guys. In fact, all of the staff at Denver Health, I've had a chance to meet a number of them over the past year. And the one thing that I can tell you about them all is that there is an infectious spirit about their work. They are dedicated and passionate about Sandos Westside Health. And I met several before they even knew who I was, and they just laid it out. And it's touching to me. But it's something that doesn't happen a lot in today's society. So we have to pay respect to that type of passion. It's meaningful, and these are the results of that kind of dedication. So to all the staff, right on. You guys are awesome. Thank you so much. Guys, it was a long time ago, many decades, that our family stood here and opened this facility. And a whole bunch of our families here today, and I want to thank them for doing that. I wonder if we're all going to be here 40 years from now. I don't know about that part, but I hope we are, and I hope we're doing more with this facility, because it is a gem for this society and this community. My dad was incredibly passionate about service to the community, whether it was for the Westside Health Center, whether it was for our Christmas basket program that we run this year. I know, sorry about that. I'm gonna pinch that a little bit, you guys. If you want to participate, let us know. We'd love to have you. We've been running that program for almost 60 years now, and we're so excited about it. It's one of the things Dad did. But his passion, I'm going to give you an example of his passion. There's a story that goes on. Back in the 60s, we were all hanging around the house. I have 6 brothers and 2 sisters, so when I say we were all hanging, we really were kind of hanging. And Dad walks into the house one day, and he says, he starts unplugging the TV. And we're like, hey, Dad, the game's on. Dude, what's up here? And he says, well, I'm taking this TV down to the clinic because they need to watch something while the patients are waiting. So sure enough, man, antennas, with the aluminum foil on the antennas and all that. He's pulling all this off. We're like, but the game, Dad, there's a game. But he did. That's the kind of passion that my dad had for helping others. And fortunately, it bleeds down to us, and I'm very proud of our family and what they've done with serving their community. I'm so proud of this organization and what they've done. I can't even begin to tell you how touching it is, but I'm going to end with this. When I have met the staff and seen the passion and the dedication and their commitment firsthand, let me just say, we recognize it. It looks very familiar to us. You guys are just like us. We're just like you. So from our family, from our community, thank you. Thank you so much.
All right, we're going to do a few photos. We're going to start with our speakers, and then we're going to add and I see 2 of our Denver Health Community Health Services Board members I didn't lay eyes on before, Connie and Veronica. So we're going to do one just with the 5 of us. Then we're going to have our Denver Health Board members come up. And then there's so many people in the Sandos family, it appears. I don't think we have enough shovels. We're going to dispense with vests because we're not really building anything, but we are going to do hard hats. So we've got some folks to bring them over, but let's start with the mayor, the councilwoman, and Simon and Dan. So bear with us for 1 second while we organize.
All right, maybe we should count down.
This microphone, you need to be like in it.
5, 4, 3, 2, 1. Great. Go ahead and toss it. Woo! All right, thank you so much. Yep, now we'd like the Denver Health Board members to come on up. All right, in 5, 4, 3, 2, 1, toss! All right, thank you so much. Now, we would like to invite the community board to come on up. All right, community board, let's count down from 3, 2, 1, toss. Thank you, community board. Let's invite the foundation board up. All right, thanks for that group. Now we're going to have the West Side leadership team. Great job. Thank you all for being here.